On the My Flow to Green podcast, we have patient advocate Roger and Adam with us today, and we're going to talk a bit about pain management, chronic pain, and how we can maybe manage that with medical marijuana. Pain can be debilitating. I mean, let's face it, in today's day and age, we're in the middle of an opioid epidemic, and it's also fueled by a fentanyl crisis and illegal drugs. And opioids, they're being prescribed by doctors. And this, it can be easily abused because they're so unbelievably addictive, physically addictive to your body. And a great solution can be medical marijuana because it's not physically addictive in that manner. And in many, here on the My Flow to Green platform, we have thousands of patients that are managing their pain with medical marijuana and getting away from those opioids. And we're just seeing so many positive outcomes here.
Every day.
But, pain there's no two pains that are exactly the same, right? Yeah. There's always different levels of pain. And I think we should kind of talk about what that looks like and how we can maybe manage that with cannabis.
Well, I think the important first step to take when you're looking at treating pain with anything is to really kind of diagnose what kind of pain you're dealing with. Sounds kind of weird to say at first, but there are different kinds of pain. And so once we appropriately kind of diagnose what's hurting and how it's hurting, then we can really look at how we're going to treat it, right? And so is it going to be chronic pain, something that's either lasted for 3 months or longer or come and gone for 3 months or longer? Is it acute pain, something that's fresh and new to the scene? Is it visceral pain, something that's coming from the viscera, the tissue, the organs of the body? Or is it something that's, neuropathic? Is it something that's coming from the nerves and the spinal cord? And so usually we know like visceral pain from the muscle, from the organs. If that's hurting and it's not acute, if it's not something fresh, generally that would be disruptive damage, right? That would be cutting, tearing, something that we clearly know why that hurts. And usually the best thing to do is take care of it, clean it, wrap it, that kind of thing. But when it comes to the chronic pain with visceral, that's a lot harder to diagnose. Generally, that's coming from a place of inflammation. Because it's sick with some kind of this or that, it's infected with this or that. And so a lot of times if you have a long-term visceral pain, using CBD can be really soothing. CBD helps with inflammation. It helps with muscle contractions. And so when it comes to kind of that visceral tissue organ-based pain, CBD can really be a rock star. On the other hand, when it comes to neuropathic pain and pain in the nerves and in the spinal cord, THC can be wonderfully soothing, helps kind of soothe and turn off those receptors. And so, like I said, really the first step when it comes to how are we going to treat this pain is really kind of, okay, well, what kind of pain are we dealing with? Like you said, no two pains are exactly the same, but a lot of pains can at least be thrown into one ballpark or the other, and being able to distinguish that is kind of the first step of being able to see how are we going to use this plant and what part are we going to lean on? Yeah,
that's such a good point because, we see patients all the time and they'll say, well, my friend uses this strain or this particular product to help with their pain, but it doesn't necessarily help me with my pain. Why is that the case? Well, that's why, because there's different types of pain and it's hard to get at certain ones. Like I know neuropathy, that one's a tough one.
Absolutely.
That's a tough one. No two regimens for two different people are going to be exactly the same with neuropathy.
And that's hard too, because a lot of patients, especially when they're coming from if they've been on opiates, they've been in the hospital, they're used to taking pharmaceuticals. And so they want to try and stay, as kind of clean cut and away from, the psychoactive sensation and that kind of thing. And so it's almost easy to get them to try the CBD side of things. But if your pain is neuropathic, then what you need is the THC, and that's going to come with some psychoactivity. I'm real sorry about that. Probably not as much psychoactivity as your benzos, but that's a different conversation. And so you're really right. The CBD might work for your friend because their pain is all inflammation based. If your pain is neuropathic based, then it's not going to help you at all. You're going to need the other side of the plant.
That's a good point. Anyone who's afraid of being, having the psychoactive effect on THC, well, if you're already taking benzos and opioids and this concoction of pills that the doctor's giving you, guess what? You're already high. You probably just don't realize it right now.
Yeah, you might as well be feeling good too.
Exactly. You might as well feel good and actually get better. So I think it's important to talk a little bit more and just kind of dive into the role of THC and CBD and how it works in the body, just so that people have a general understanding how that works.
When it comes to these two cannabinoids, firstly, you have THC. it binds to the CB1 receptors within the brain and the spinal cord, which actually alters your perception of pain, which for a lot of patients, it helps them find relief when it comes to that chronic neuropathic pain. Just to piggyback on what Adam actually said earlier, that if what your friend has for inflammation, you have neuropathy, it's just not going to work. Then you also have CBD, and that actually binds to the CB1 and CB2 receptors within the endocannabinoid system, and that actually helps out tremendously when it comes to any inflammation within any of the visceral organs or the viscera.
That is really amazing. And I think it's a key thing to understand too, because cannabis is an individual response. Everyone's going to be a little different, so, everyone's sensitivities level is a little different. Some people have very high tolerances. Some people have very low tolerances. And when you start down this path of treating with cannabis, it's going to be an experiment. So I think a key thing to outline here is, for example, if you're trying an edible, for example, to relieve your pain for the evening so you can get some sleep, well, maybe it's too intense. Maybe that psychotropic aspect of it is just too intense for you and you don't like the feeling. Well, guess what? You can take CBD to reverse it. A lot of people don't know that, and everyone needs to know that. I think we might talk about this on every episode, and that's okay, because CBD, if you have, and it's typically a 5-to-1 ratio. For every milligram of THC you have, you want 5 milligrams of CBD. One of the best strategies is take that CBD dropper of oil, put it under your tongue, let it just sit there till it absorbs. Give it about 20, 30 minutes and it'll snap you right out of it.
And that can be super helpful, especially for some of our patients. Like you said, some of our patients have really high tolerances, and that's not necessarily their fault. That can be genetic as well. And so if you have someone that's coming from an opioid background that has a genetically high tolerance to marijuana, that's actually going to be linked to their high tolerance to painkillers, which is probably why they're, having problems with opioids in the first place. And then, they go in and take the standard one edible and they're like, okay, well, this didn't do anything. And so then they take 3 or 4 more and they're like, okay, well, now I'm just really stoned.
Right.
And, they get uncomfortable. And so it's really important to go, yes, you might have to take more THC in order to get the relief in your system that you need, but you can pair it with the CBD so that way you don't have to just fall down this psychoactive rabbit hole.
Right. Yep. Exactly. Because, that is one of the things with THC. I mean, some people can get a little paranoid if they have too much or the wrong strain. CBD mitigates all of that.
Yeah.
Right?
And then even for our more experienced users, when it comes to CBD, it actually is a great refresher for your nerves in order to onboard THC the next time you do use it. When it comes to THC, it binds within the nerves within your body, and that's actually what makes you have that psychoactive feeling and effect. However, CBD actually blocks those same nerves. So when you actually take it within the morning after you take your THC, you're actually refreshing it and making it more readily available when you do absorb THC next time.
Right. So, it really is. There's so many benefits to mixing the CBD and THC.
Absolutely. They work together so many ways in the body.
Exactly. So, I think another point that we need to bring up is, is for some of our people that are in the program, that are kind of treating on their own. The question I think they should pose to themselves is, am I treating or am I preventing or am I doing both?
Yeah.
Because I think that's a key distinction there. For example, when you smoke cannabis, it's going through the capillaries of your lungs, goes straight to your CB1 receptors in your brain. So you're really just treating because you're not getting enough and you're not engaging that, what we call the endocannabinoid system that helps you regulate your body.
Exactly.
So you're not engaging it that way, but you are treating and you're getting instant relief. And I'm not saying that that's a bad thing because you might need instant relief if you're in a lot of pain.
Absolutely.
But when you digest it and you metabolize it, there's an enzyme in your liver that breaks down the cannabis and interfaces with your endocannabinoid system. And that's where you're starting to be more preventative because then you're starting to heal the endocannabinoid system and help bring it into more of a balance so you're not in as much pain all the time.
Absolutely.
And a good strategy can be a combination of the two.
Exactly.
Get you out of that pain, get you in a better headspace because your pain's a little bit lower. You can use an inhalation method. There's many variations of that. And then take your edible as well or a tincture to help with that longer lasting pain relief.
Exactly.
Absolutely. Especially if your pain, as silly as it might sound, is something that's, a little bit more complicated. Mixing methods is probably going to be what ends up getting you the best result. I know that a lot of our patients who struggle with like migraines and things, that one's a really hard one to diagnose as far as, is that visceral or is that nerve pain? Because I know that if I just take THC, that doesn't necessarily help. And so I know a lot of our patients have really found success with doing topical, a THC topical at the base of the spine behind the head, and then at the temples, and then comparing it with a tincture. That way they're getting that topical to help with kind of the instant relief and the instant inflammation, and then that tincture is processing. And then, you can, top it off with some inhalation too if needed. But mixing those together is one of those things, especially like I said, for patients with migraines. That's one of the best responses that we've seen, one of the most effective methods.
Yeah. Well, and another key, area of pain, females have to deal with. They have the reproductive system that can get very complicated. Yep. And earlier we had a little segment with Laura Gerlay, and she shared some information about how she's used cannabis to help her in her journey.
So in talking about chronic pain, I know that the female reproductive system can be a complicated place when it comes to that.
Yeah.
So Laura, can you tell us a little bit about how cannabis has maybe helped you on your journey with it?
Sure. We're about to get real personal here, Chad. So I have been one of the unlucky people who always had pretty severe menstrual cramps. So I got my period at 12, and ever since then, it's been really difficult for me to manage. I mean, even when I was in high school, I wouldn't make it to school just because of how much pain I was in. Luckily, right after I gave birth and I had my first cycle come, I had already knowledge about CBD and THC, so I started experimenting with that to try to see if I could help alleviate some of the pain that I was having. So what I discovered was that I could actually create my own suppositories, like vaginal suppositories. So I would put CBD distillate with some coconut oil, and that actually did help reduce the pain. CBD is also really good for like muscle spasms. So some of like the pain, sometimes I would relate the menstrual cramp pain as like contractions, like birth contractions. So that is one of my things that I do every month when I have my cycle is I take my CBD oil. If it's really bad that time, then I'll create my suppositories. For those people who are, into THC, THC is amazing for pain. I've seen a lot of people use the topicals like on their belly. A lot of women do that, or taking the drops. Sometimes I even get nausea from my period. So, and that is something that CBD actually can help me sometimes, as well as THC can help with that as well. I think there's so much data and information about that I feel like we need a whole new segment to touch base on, because like you said, it is a very complicated system, but it is also amazing how all these plant-based medicines can help symptoms like that and can help us.
Thank you for sharing.
Yeah.
It was a bit of mercy, and we really appreciate that. I feel like we're going to have to dive into that a little bit more with a whole full episode because this is important information to get out there. I mean, guys, we don't know anything about that, but I just know what I see with my wife at home, and this really could help so many people.
Yeah. Yep. Absolutely. I agree. Yeah. We'll have to table that for another episode for sure.
All right.
Thank you, Laura, for sharing some of those thoughts on how you've gotten some help with cannabis. So I just we're coming towards the end of the episode here. Any final thoughts for anyone out there that might be dealing with chronic pain of any sort? What would your advice be to them?
I think the biggest thing is just why wait? Get in here and get some help. At this point, most of our patients that have been dealing with chronic pain have tried most medications either behind the counter or at the doctor's office. What's stopping you from trying this one? This might be the one that helps. We've seen it work time and time again. We can definitely give you the tools to use it appropriately for your best chance of success.
Absolutely.
Exactly.
Absolutely. So if you're interested, if you've tried so many different methods and you've never gone down this road, go to myfloridagreen.com, click Get Started, fill out the questionnaire, come in and get your appointment, and we will get you educated and we will set you on the path to getting some significant relief to your pain.
Absolutely.
Don't forget to like, comment, and subscribe.